All right, welcome back, everybody. Today, we're going to really get into a topic that seems like it never leaves the news cycle. U.S. healthcare.
Definitely a hot button issue.
Yeah,
Yeah.
absolutely. We found this really in-depth research article, and basically today we're going on a deep dive into it, exploring the good, the bad, and the ugly of the U.S. healthcare system.
Right.
So, is the U.S. healthcare system truly broken or just uniquely different? I guess that's what we're here to kind of figure out.
Yeah, it's a question that a lot of people are grappling with, and for good reason. There are so many moving pieces. You have costs, you have coverage, you have quality of care, access to care,
Right.
and it impacts every single one of us in some way.
And we really want to hear from you guys on this one.
Mhm.
What are your experiences? What are your thoughts? Leave us a comment. Let us know. Let's get a conversation going.
Absolutely. Love to hear from you.
So let's start with something that I think we can all agree on, the price tag. This research article brought up a pretty crazy number. The U.S. spends more per person on healthcare than any other developed country. We're talking an average of like $12,500 per year.
Yeah. Per person.
Person, yeah.
Crazy, right. But the crazy part is that we're not seeing better health outcomes.
Right, and that's the really interesting thing, right? All of this money doesn't seem to be translating into things like longer lifespans or fewer cases of preventable diseases.
Right.
When we compare the U.S. to other, let's say, wealthy nations, we are lagging behind in those key metrics.
It's true.
So the question is, why are we paying so much for what appears to be, let's say, less effective care?
Yeah. I mean, that's the million-dollar question, right? Why is this happening? This article points to a few different factors. One being just the pure complexity of our insurance system.
Right.
Unlike other countries, many countries who have a single government-run system, the U.S. has a mix of public and private insurers, which just creates a ton of administrative overhead.
So much overhead.
Yeah.
And all of that administrative cost, it really adds up, right? We're talking about all the paperwork.
All the billing systems, negotiations between insurers and healthcare providers.
Oh, my gosh.
It's a lot. And this is one area where other countries with, let's say, simpler systems have really streamlined things and have been able to keep costs down.
Right. It's kind of mind-boggling to think that we're spending so much money on paperwork instead of on actual patient care.
Yeah.
On top of that, this article also highlights the issue of high drug prices in the U.S. I mean, we've all heard stories about people, rationing their medicine or going without because they simply can't afford them.
Yeah, it's really a problem. And I think it begs this big question. How do we balance, innovation in medicine with affordability?
Yeah.
The U.S. is, absolutely a leader in pharmaceutical research and development. New treatments are always coming out. But the system currently is set up in a way that allows for pharmaceutical companies to set prices, basically, with very little regulation.
Right.
And this unfortunately results in some extremely high costs for patients.
Yeah. It's a tough situation. It's tough to balance, like you're saying, that innovation.
It is.
And that brings us to another really, I think, big challenge that this article really highlighted, and that's the lack of universal health care coverage in the U.S.
Huge problem.
Millions of Americans are either uninsured or underinsured, meaning they don't have access to affordable, quality health care.
Comprehensive care, right. They just don't have it.
Right.
And the impact of this, I think we can all agree, is extremely significant. Even in states with relatively low uninsured rates, we still have more people going without necessary care than in countries with universal health care systems.
Yeah.
And this can lead to, the list is long, preventable health problems, delayed diagnosis, and ultimately poorer outcomes for patients.
It's really sad to think about the fact that people are suffering, or sometimes even dying, because they can't afford to see a doctor or get the treatment that they need.
Yeah.
This article really, I think, does a good job of driving home that human cost of these systemic problems. It's not just numbers on a spreadsheet. These are real people's lives.
Yeah, it is. And that's exactly why I think this discussion is so important.
Sure.
Healthcare is not just a policy issue. It's a human rights issue.
Right.
Every single person deserves access to quality care, regardless of their income or employment status.
Absolutely. I completely agree with you. And speaking of health outcomes, this article paints a pretty sobering picture when it comes to preventable deaths in the U.S.
Yeah.
We have one of the highest rates among all developed nations, which is...
They're pretty alarming.
Yeah, it's kind of scary.
Especially when you consider that in 2021, No U.S. state had a life expectancy above 80 years.
Wow.
That puts us behind so many other countries that are on a similar level of development.
Right.
And it really just underscores the need to really look at this closely and figure out what is driving these preventable deaths
Yeah.
and how can we do better as a country.
So we've got high costs, we've got coverage gaps, and we've got concerning outcomes. It's a lot.
It's a lot. But before we get too bogged down, I think it is important to note that this article, it doesn't paint the U.S. healthcare system as a complete failure.
No, absolutely not.
There are definitely bright spots. There are definitely areas where the U.S. really excels.
For sure.
Like, for example, our, world-class medical research and innovation.
Absolutely, yeah.
I mean, huge strides have been made in treating things like cancer, heart disease, and neurological disorders.
Oh, absolutely. The U.S. consistently ranks among the top, in the world for medical breakthroughs and technological advancements.
Right.
And we have a really strong track record of developing, really cutting-edge treatments and therapies
Right.
that benefit not just Americans, but people all over the world.
That's true. That is definitely a point of pride. And, beyond research, this article also mentions, the availability of very specialized care in the U.S.
We have, a huge network of specialists and hospitals with just incredible technology.
Top notch.
Yeah, offering access to treatments and procedures that you might not be able to get as easily in other places.
Yeah, I mean, if you think about it, this level of specialization allows for very, targeted and really advanced care.
Right.
So think about, organ transplantation, for example.
Yeah.
The U.S. leads the world in the number of organ transplants performed every year, in large part because we have this incredibly sophisticated infrastructure
Right.
and the expertise.
So, we have our challenges, but we're also doing some things really well.
We are. We are.
And this article also highlighted something I thought was interesting, this element of choice within the U.S. healthcare system.
Right.
Unlike other systems where the government is the sole payer, patients here can choose their doctors, specialists, and even their insurance plans.
Yeah, and I think that element of choice can be really empowering for patients.
Right.
Allowing them to actually seek out providers and plans that meet their specific needs and preferences.
Right.
And I think it also can, in a way, foster competition within the healthcare market.
Oh, interesting.
Which can drive innovation and improve the quality of care overall.
Yeah, that makes sense. Okay, so we've kind of got this, we're painting this complex picture here, right?
Yeah.
Strengths and weaknesses.
Absolutely.
And of course, the question of, healthcare reform is a very hot button issue.
It is.
This article goes into kind of both sides, arguments for and against major changes to the system.
And there are definitely strong opinions on both sides. Proponents of reform, they often point to the successes of, these universal healthcare systems in other developed countries.
Right.
And they say, hey, look, these systems, they're more efficient. They deliver better health outcomes at a lower cost.
Right.
And they also emphasize, that moral component. They say that, look, every single person should have access to health care regardless of their income or social status.
Right. But there is pushback. Right?
Absolutely.
There are people who are not so keen on the government taking over healthcare.
Yeah. Critics of reform often bring up concerns about, potential downsides. For instance, longer wait times for certain procedures.
Right.
Less individual choice, when it comes to healthcare decisions. And they worry that a government-run system could really stifle innovation and limit the development of these new treatments.
Right. So it's a tough debate. Valid points on both sides.
For sure.
It seems like finding a solution that actually addresses the problems without creating new ones is really, really tough.
It is. It is a huge challenge. And I think, for me, it comes back to, the fundamentals, right?
Yeah.
We have to ensure that everyone has access to affordable, high-quality care.
Right.
And we need to figure out a way to control costs, but we can't sacrifice innovation or patient choice.
Right.
It's a really delicate balance.
It is.
It's not an easy fix. But, I truly believe that if we have this open dialogue and we're willing to consider different viewpoints, we can actually find solutions together.
Yeah. And that's why we want to hear from you guys.
Exactly.
Our listeners. What are your thoughts after hearing, just the first part of our discussion today?
Right. What resonates with you? What are your own personal experiences with the U.S. healthcare system?
Right. Have you experienced any of the challenges that we've talked about? Have you found any solutions that make you feel hopeful about the future of healthcare?
Yeah, we want to know.
We want to know. Leave a comment. Let us know. Share your thoughts, your insights, even your frustrations.
Yeah. Because your stories and your insights are so valuable to this conversation,
Yeah.
it helps us understand, like, the real-world impact of these complex issues. And honestly, it helps to inspire us to keep looking for answers and solutions.
Absolutely, and we are going to keep talking about this in part two. We're going to get into more, the strengths of the U.S. healthcare system. So stay tuned for that.
I'm looking forward to it.
Yeah, me too.
Should be great.
Okay, see you guys in part two.
See you then.
Okay, so, we've been talking about like the downsides and the challenges of the U.S. healthcare system, but this article also highlighted some things that the U.S. does really well.
Yeah, absolutely. Like you were saying earlier, the cutting edge medical research, right?
Right, and the specialized care. I
Yeah.
mean, those are two really big things that, a lot of other countries don't necessarily have.
And it all kind of ties back together. We talked about how the U.S. has this mix of public and private insurance, which, can create a lot of administrative headaches.
Right.
But it also contributes to this diversity of care options.
Oh, that's interesting.
Because you have different players in the market, you get more specialized services and treatments.
Okay, so even that complexity,
Yeah.
it has a silver lining in a way.
Yeah, exactly. I mean, it's not a perfect system, but it's definitely got its advantages.
Okay, so let's talk more about that specialized care. This article brought up some interesting points about that.
Yeah, the U.S. is really a leader when it comes to certain areas of medicine, like organ transplantation.
Right, you mentioned that earlier.
Yeah, and that's because we have a lot of very highly trained specialists, the technology, and really the infrastructure to support these complex procedures.
Okay, so that's a huge plus. I mean, if you need that kind of specialized care, the U.S. is probably the place to be.
It's definitely a major strength of our system. And then there's also the factor of choice.
Oh, right, right. We talked about that a little bit too.
Patients in the U.S. have more options than in a lot of other countries, right?
Mhm.
You can choose your doctor, you can choose your specialist, you can even choose your insurance plan.
Right.
And that can be really important, especially when it comes to, finding a doctor who you trust, who you feel comfortable with.
Right. So there's that sense of autonomy, which, can be really empowering for patients.
Absolutely. And I think that's something that, we often take for granted in the U.S. It's not like that everywhere.
That's true, yeah. Okay, so we've got these strengths, but we've also got, these big challenges that we've been talking about, like high costs, lack of universal coverage.
Yeah, the question of healthcare reform is a really big one.
And this article, it really dives into both sides of that debate, arguments for and against major changes.
And both sides have valid points, There's no easy answer.
Right, so like what are some of the main arguments, let's say, in favor of reform?
Well, a lot of people point to the success of universal healthcare in other countries, right? They say,
Mhm.
look, it works there, it can work here.
Mhm.
They argue that, with a single payer system, we could streamline a lot of that administrative complexity that we were talking about,
All right.
potentially negotiate lower drug prices, and just make healthcare more affordable overall.
Okay, yeah, that makes sense.
And then there's also, the moral argument. They say it's simply unfair that so many people in the U.S. struggle to afford basic health care.
Right, right. Everyone deserves to have access to care, regardless of their income or employment status.
Exactly.
Okay, but like you said, there's pushback too.
There is. There's definitely a lot of people who are, very skeptical of government-run healthcare.
Yeah, I mean, I think a lot of that stems from, concerns about potential downsides.
Right, like longer wait times for certain procedures, maybe less individual choice.
Right, right. You're kind of at the mercy of the system.
Exactly. And some people worry that, a single-payer system could discourage innovation in the healthcare industry.
Oh, interesting. So they're concerned that it might slow down like the development of new treatments and technology.
Exactly, yeah. There's this concern that, without the profit motive driving research, we might not see as much progress.
It's a tough one because it's like, we want healthcare to be affordable and accessible, but we also want to encourage that, that cutting edge research and innovation.
It's a really tricky balance.
Yeah. So I mean, clearly there's no easy fix here. But, after reading this article and talking about this, I feel like maybe the first step is just having these conversations.
I think you're absolutely right. Really listening to each other, understanding the different perspectives, that's how we start to find common ground.
Yeah. And that's why we want to hear from you guys, our listeners.
Exactly.
Yeah.
Tell us what you think. What are your experiences with the U.S. healthcare system?
Right. What parts of it are working well for you?
Yeah.
What needs to change?
What are you hopeful about? What are
Yeah.
you worried about?
Yeah. Leave us a comment. Let's keep this conversation going.
Absolutely.
Okay, so we've talked about a lot. We've covered the high costs, the coverage gaps, the reform debate, but now we want to hear from you.
Yeah, exactly.
What are your takeaways?
We've thrown a lot of info out there,
Yeah.
but now we want to turn the tables.
Right.
What parts of the U.S. healthcare system do you think are working well?
Yeah.
What needs the most attention?
What about you guys? Have you experienced any of these challenges firsthand?
Yeah. Have you seen any innovative solutions out there that make you feel hopeful?
Yeah, we want to hear your stories, your insights, even your frustrations.
Yeah, because those personal experiences, they really help to paint a clearer picture.
Right.
They help us understand the real impact of these complicated issues.
Absolutely.
And they inspire us to keep searching for answers.
So head over to the comments and let us know what you think.
Yeah, let's keep this conversation going. Maybe
Yeah.
we can spark some new ideas together.
Yeah, because at the end of the day, healthcare is about people.
It is.
It's about making sure everyone has a chance to live a healthy life.
Absolutely.
So to wrap things up, we want to leave you with something to think about. If you could change one thing, just one thing, about U.S. healthcare, what would it be and why?
It's a big question,
Yeah.
but we believe that even small changes can make a difference.
Right.
So think big, think critically, and share your vision with us in the comments.
Thanks for joining us for this deep dive into the world of U.S. healthcare.
Yeah, thanks for listening, everybody.
We look forward to hearing your thoughts and continuing this conversation.
Absolutely.
Until next time, keep diving deep and stay curious.